My name is Brandon Hayes-Lattin, and I'm the Medical Director of the Adolescent and Young Adult Oncology program at OHSU. We started the Adolescent and Young Adult Oncology program at OHSU to serve patients diagnosed with cancer between the ages of 15 and 39. And the reason for that is these patients have a whole unique set of medical needs and a whole unique set of support needs that we want to make sure are covered through OHSU. So when an adolescent and young adult gets diagnosed with cancer, they often feel alone. They feel very isolated because when they go to the doctor's office, oftentimes the people around them don't look their age. And yet it turns out that cancer is one of the most common medical problems that an adolescent or young adult might face if they have a medical problem. So we want to make sure that patients don't feel alone, whether that's in the medical field in terms of what's going on with their diagnosis and their treatment. Can they talk to other people who've gone through this? But also in the support arena where, again, patients don't want to feel alone dealing with school or work or family issues, dealing with fertility or other effects from the cancer. So I was particularly interested in developing this young adult cancer program because I knew firsthand some of the issues that young adults faced. I was diagnosed with testicular cancer when I was 28, and while I understood the medical side well, I didn't know ahead of time that there's this whole world of young adults looking for each other. And I found through the Lance Armstrong Foundation that there was a lot of interest in creating new support services. Well, when we started the program for adolescents and young adults, one of the things we looked at was why are outcomes sometimes worse for this age population? And when we look at that, we see that young adults historically have a very low rate of participation in clinical trials especially compared to younger children, but even compared to older adults. If we see a newly diagnosed patient with cancer, the one most important thing is that they're not alone, that we understand what's going on in terms of the medical side and the supportive care needs, and that we can help plug them into other patients and services to help get them through.